We've now been here 15 days. Within that time, we've met a lot of the consultants, nurses, student nurses, and everyone's been very reassuring. Me and my wife, obviously it's a very traumatic time, and they were very comforting, very patient, explaining everything to us. Because obviously some of the stuff, we both don't have medical backgrounds, so there was putting in a layman's terms, which was brilliant. Even helping us with the cares. So, even though we have 2 kids before this, it's quite daunting when you first see your newborn in an incubator. You don't know you're allowed to touch them. So they come over and they just give you a bit of a push to say, get your hands on, get a bit of skin on skin action. But yeah, no, it's been brilliant. It really has.
Since being in hospital, I feel the nurses have really helped, and the healthcare and student nurses have all gone out of the way to support me with the baby whilst I've been here, and obviously I've been on my own. Obviously when my family aren't here, they've assisted me with feeding him when that's been a struggle, helped me with changing him when he's sick, and just supporting me like with conversations, asking if I need anything, always just being around to help. Really, been really great.
Well, it's been really worrying, obviously, having such a young baby that's been really poorly, not feeding, and they've made this experience so positive. They've been really helpful, kind, caring. They've just really looked after us, really reassured me. They've even taken the baby at night time and had him for a few hours so I can get some sleep. Honestly, they're worth the weight in gold. Everything they've gone through really slowly with me. They've asked questions, they've made sure that I'm confident. They haven't rushed me to go home. They've keep popping in, asking me if I'm okay. They've just been brilliant. Honestly, I can't praise them enough. I can't say I've enjoyed my time here, but I have, to be honest with you. I can't really fault it.
I've been in and out with different surgeries. I've had 28 procedures now. This is my 20th what I've just had now. And all I can say really is the nurses have been fantastic. Like I say, they saved my life on more than one occasion as well. I'm only here because of you, to be fair, like. And that's the gospel truth of it all, like.
Yeah, the experience has been alright. Come in from the first operation, expecting to be an overnight, little complications, so I ended up staying in, but ever since I stayed in, all the nurses, the student nurses, been spot on. I haven't needed for anything. Every time I'm in pain, it's there straight away, relief. At the ward, it's a happy ward. I mean, everyone's pictures together, so it's a decent experience. It's I've been happy anyway since I've been in.
The staff in here have been absolutely excellent. They've looked after me. They've looked after all these people that's in this ward. I would say about 90. I'll give them 99%. I'll knock 1% off just for the cheek. But that's what they are good. I say it's my second time in this ward, like, and experience has been good. Food's been good. Now and again. But saying that though, at the start of this week, like Monday, Tuesday just gone, it's been great.
Excellent.
Somebody must be listening to me.
So I've been here quite a few weeks now, Jan, and with regards to the hospital and all the staff, it's lovely. They're all nice to talk to you, and they help you as much as they can. Try and keep you like positive and things like that. So they just help you every day, support you. As I say, no problems. They've been lovely, and although it's not nice to be in hospital for a long time, that helps along the journey, doesn't it? So tell us what they're going to do, and as I say, we get I've had different people around, doctors, occupational therapists, physiotherapists, so the full remit of team, I think. I've seen every man and his dog. But as I say, they've all been lovely and helped you along the way.
It's all been great. Can't really fault it, to tell you the truth. Really spot on. The food's been alright. Apart from we've got a bit of a delay on our next appointment, like. But no, been wonderful. Can't fault it. Wasn't it? Good party, yeah. Had a good laugh, yeah.
That helps.
It does help, yeah. And sit like dummies all day, yeah. Very good. Yeah.
Excellent.
Well, no complaints whatsoever. Looked after me well, kept me going, and making me better. Touch wood. Been very instructive wherever they know. If you ask questions, they don't mind answering them. So they've kept us well up to date with everything that's happening. 20 odd years since I've been in hospital, so
Wow.
you just have to accept it. You can't do nothing about it. You open the professions, look after you correctly, and that's all you want.
It's the second time I've been here. I was here 2 years ago and nothing's changed. The staff are absolutely fantastic. Can't do enough for you. Food's good. You get to know what you need to know, the procedure and everything. I can't thank them enough, for what they do. You all chip in to help each other out. Nobody's got like one set job. You all muck in and do everything to help each other, which is great to see nowadays, because usually places like, not the health service but other work environment, it's everybody for themselves, but not in the hospital. It's been absolutely fantastic, because you get well looked after and they're there to help, and nothing's any trouble for them. If you want anything, you just ask, and if they can get it, they can get it for you. You're a miracle people, like.
To be honest, I wouldn't be where I am now if it wasn't for the staff that have helped me through it. I mean, when I came in here 3 weeks ago, I couldn't even lift myself out of bed, or I couldn't even sit myself up. And now I can get out and walk about. I can feed myself. I couldn't do any of that when 3 weeks ago. It's been a very good experience, you know. If you can have a good experience in hospital, but yeah, I'm more than happy with the way I've been treated and the way I've got on.
My feeling about all the staff is they've just been absolutely amazing, just beautiful people. It's the empathy and the care that they've all shown is just up there, you know. Yeah, hats off to them all. I haven't had a bad experience with any of them. Even the porters taking us down to X-ray, you know, they have a bit of banter and a bit of fun. Just everybody's been lovely. I mean, it didn't help at first. Obviously, when I was in, I was full of morphine, but now, yeah, everything's clear and cut as to what's happening. So yeah, it's always nice to know. The support's always there, isn't it? And granted, maybe it's on an evening they're a little bit rushed, but it's a hospital. What can you expect? But overall, you cannot knock this hospital at all. You know, can't knock the NHS. I certainly can't. So yeah, everybody's been absolutely amazing.
They're amazing. They really are. They'll talk you step by step through it all. I've got no faults at all. And he has his thriving since he's been here. There's not really much to say. He's only 2 weeks old, but yeah, everything is amazing. They've joined me to the Leos as well, which is for neonatal parents. So yeah, they're fantastic. If you've got any questions, they'll help you. If you're struggling with anything, they will. So I've got no faults at all. Definitely, they talk you step through step, and they make sure you understand it, and they put it in like our terms, not the doctor's terms, which is good. But yeah, he's thriving. Doing really well.
As I got here, everyone was really lovely. The nurses were brilliant, and they were really, really reassuring. And they stayed with me, and they stayed with my husband. And what was really nice is that they actually spoke to my husband as well, like he was part of the experience, and it wasn't just me. Then I ended up having an emergency C-section, and there were so many people in the room. However, every single person in the room come to talk to me and made me feel at ease. And I just felt like royalty, like somebody just came and they just looked after me all the time. They popped in every couple of hours. So from being discharged to now being a regular neonatal mum now, every time I walk in, friendly smiley faces, everybody reassures me. They're like, this is what's happened overnight, this is what's happened since you've had your lunch, and it just feels really nice, really kind, really friendly, and it's no longer scary walking in, because you just feel like part of the community now, and everybody's there and they've got all the best interests for my son, and actually he's doing better than what I could have imagined. And actually it's nice having like 20 million parents basically here watching him, compared to me worrying at home.
Found the staff incredibly good, and I was put on. I've been on to various wards in the hospital, but this particular ward I found is one of the most friendliest wards, and where the staff are so kind to you. Right, you forget that they're actually nurses. They're more like it's like you're shouting for your friend. Do you know what I mean? But like sometimes I ring the bell and they think, oh no, it's there again. Right, I try not to press the buzzer too much, but yeah. No, it really is a great atmosphere, and the staff are so good. I just can't fault them at all. I just can't fault them, even down to the doctors.
So I've been in hospital for a few weeks now, and I sort of started off here. I was in intensive care, and I like the nursing staff, the medical staff, everyone, everyone was fantastic. I think they went sort of above and beyond really what I would normally expect, in making sure that I was like well cared for, like little things like making sure my hair was done, going out into the garden, that made such a huge difference beyond just like looking out for my medical needs, and I think that's continued throughout, and despite the admission being quite difficult and being quite unwell, like it's made it so much easier, and I think my recovery has been much better because of it. So, yeah.
The care I've had has been absolutely excellent. I've had to use a BiPAP machine, which I've never used before, and it's not very comfortable to sleep with. So I was initially told that I need to sleep with it overnight, but I just can't manage it. So the staff have been really good. They've come and sat with me and talked me through it, what the machine does and everything. On the whole, if you ask them for anything at all, we had some of the student nurses, they're sort of just wise beyond their years. There was a lady last night, a young lady called Jess. She couldn't have been more helpful. She tried. Anything you asked her, she was there, she would do it. You try not to keep buzzing. You know they're busy. I'm not the only person in this hospital. There's lots of other people. But yes, certainly very, very happy with the way that she treated me. So yes, and then the physios have been great. I mean, I know there aren't enough physios in hospital, but they're coming round, they're getting me out of bed, because obviously I can't walk where I've been confined to bed for something like 4 or 5 weeks now. So they've been coming, getting me out of bed, and they're encouraging. They won't do things for you, I've noticed, because to start with you think, oh, they can pull me out of bed, but they won't. They'll make you do it, and obviously that's the only way you're going to get better, is if you physically do it yourself. So, you know, they've been very encouraging.
Yeah, I think the nurses have been phenomenal. They've been brilliant in looking after me, ringing the doctors if anything's going a bit wrong. And the healthcare has been exceptional as well. There's one lady in particular, she's called Sam, she's cut my hair, she gives me lovely washes in the bath, puts loads of bubble bath in so that it flows out of the bath, and just all the staff really have made sure that the experience is as much as like home as possible, because it's a long time being on this ward, I think, and they go above and beyond to make it as nice as possible. Yeah, all the staff come in and they're smiling and they're singing, and it's good. Yeah, it's been really lovely. All of them lovely. My favourite person is Sam that I mentioned. Isn't she lovely, Margaret?
They make you feel like you're in a family. It's a family. It is, it's lovely. I mean, we've been here a long time, but with them, it makes it easy. You don't miss your family because they're there and they're good for you. They're good for your soul, they are. They don't get paid enough, but they go above and beyond. They're there. They don't think of themselves, they think of you. They're there for you. I mean, they're like, more than like a family. They are fantastic. I mean, I've been in here since April, but with them being in this ward, I'm alright. I don't feel like crying. It's, you wake up, you're happy, you know they're going to look after you and cheer you on. It's a good day, or every day, not just one day, it's every day. Now go to somebody else, please.
Well, thank you very much.
You're welcome.
That was really good.